So we're going to go over the crash cart on your competency checklist. So there are 3 crash carts in the hospital. This one is in the ER, and the ER also holds the only Braslo bag in the hospital. So if there is a pediatric code, or actually any code in the OR, someone is supposed to come to the ER and take the Braslo bag. This is what it looks like. It's very heavy. And on the Braslo bag, there's the Braslo tape. We'll talk about that real quick. And this is emergency guideline to use on all pediatric emergencies. It gives you a quick guideline on medications and equipment sizes to use based on the child's height. So you just use it as a general tape measure. We have 3 crash carts in the hospital. First one's in the ER with the Braslo bag. The second one is on Med-Surg in their hallway across from room 107. And the third one is in PACU in their isolation room. So right here is your crash cart, and it has all your life-saving equipment. It is mobile, it has wheels. So if someone codes in the hallway in the lobby, you can wheel this to them, probably the Med-Surg one because it's the closest. And it'll have your oxygen tank. You have your ambu bags, all sizes, infant, adult, and pediatrics, so whichever one you need. It has airways, LMAs are on here. We have the laryngoscope with blades. The doctor will decide which blade he wants. And whenever there is a code, the ER doctor is the one to respond. If anesthesia can also respond, but he's the physician on call for that. There is your suction, portable suction, nice and loud. It also operates on battery. We check that every day. We also, to my understanding, the defibrillator is ready to go with the combo pad cord already attached to it. If you for some reason wanted to use the big paddles on the back, you have to remove this and put this one on, which is back behind it. So it would probably take longer to do that than to just open up your combo pads. They will pace the patient and they will defibrillate. And on the back, they will tell you how to put them on as well. And we have pediatric ones as well, and adults. So you use the appropriate size for your patient. This blue folder, which is on each crash cart, is our code blue folder for charting and documentation for what's going on. So let's go ahead and talk about the crash, how to use this device. I know it's scary for a lot of people, but just take a breath and just look at the monitor. Right here, it says 1, 2, 3. It shows you what step to do first. First, 1, turn it on. And up on the top, up here, it actually tells you step by step which one to use. If you want to manual defibrillate, we go to step 2, select your energy, which is number 2, select energy. And then you would charge and shock. If that completely freaks you out, you can simply put it in the AED mode, and which you turn it on, which is number 1. And then number 2, you go on this side, it says analyze. And then the machine will talk to you and tell you what to do next. Yes, shock, don't shock. Right now, here it tells you what lead you're in. You can change the lead if you had it at the paddles. But as soon as you put this on, it will put it on the combo. There's an option for combo. So we talk about manual defibrillation. You choose your charge, you can shock. The AED mode, which is also up here, will tell you when it'll tell you when it's analyzing, tell you when to shock. The pacer option. So if you have a patient that needs to be paced, you come down, turn it on, and hit pacer. It tells you how to put the pacer pads on, and then it'll tell you next to select your rate. And right here there's a rate button. You can up and down. The doctor should tell you what rate they want it. Usually it's 60. And you would use the current button up and down to capture the heartbeat to start pacing with it. And so that's basically how to use this.
Okay, so I'm going to go over the difficult airway kit or cart. This is kept in recovery or PACU, in the cabinets behind the nurse's station where we sit. This can be used anytime anyone has a difficult airway, whether it's in the OR or for some reason during a code. It's locked and everything's checked by pharmacy, and it's got all the drugs and everything you might need if you encounter a difficult airway on a patient. And then as far as the pediatric emergency drugs, we have also kind of the same, looks the same as that. This is called the pediatric emergency box. Same concept. It has drugs specific to peds that you might need an emergency during a code or just any kind of emergency type situation that might not even be a code. This is specific for the pediatric patients, and again, it's checked by pharmacy and everything's kept here. This is kept also at the same spot as the difficult airway cart in the cabinet in PACU behind the nurse's station. And then the other thing that kind of goes along with the PDs, if you need, this is our tackle box. It's kept on the crash cart, actually in PACU, where in our isolation room. And this is specific to pediatric patients. So again, if you need any of the supplies, it's kind of nice to have it all right here. This is all smaller stuff. You've got your laryngoscope, your blades, some smaller airways and tubes and such that might be, obviously will be a better choice for pediatric patients. This is our MH cart, or malignant hyperthermia is what it stands for. It's kept in PACU in the isolation room, which is where we're at right now. This is basically everything that you need if there's an MH crisis or you think there possibly could be one, just to help get ready. There is some things listed here on top, what to look for, what to do. Obviously, you're going to notify anesthesia because it is an emergency. There's a 1-800 number on here, things that will be helpful. This is all, everything you need, like I said, drugs, supplies, it's kept locked. Pharmacy keeps up with expiration dates and that kind of stuff. It's plugged in. Everything on here is cold in this fridge. That's part of giving the MH care. There's also an emergency therapy kind of graph data on the side here that you can refer to as well. Again, anesthesia needs to be notified. It is an emergency, but this is all you need if you are suspecting an MH crisis. As far as drugs and supplies, everything is located right here.